Good day, good afternoon, good evening, everybody. My name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome. These events are a chance for us to engage in the conversations that shape a healthier world. We design these as spaces where we can come together to debate, share ideas, and grow our understanding of the issues that matter for health. Thank you for joining us for today's discussion. Today's conversation is part of our Challenging Public Health series. The series aims to take a self-reflective look at how public health performed during the COVID-19 pandemic. During COVID, we made many choices, some right and some wrong. I have written about these choices, as have others within our community. By engaging in self-reflection, we can learn from the times we fell short and apply these lessons to doing better in future. To inform these reflections, it's helpful to engage with voices from outside the field. Let us see our work with fresh eyes, broadening our perspective. And for this reason, we've invited people we admire from outside public health to join us for these conversations and help us hold a mirror up to ourselves and our work. Today, we have the privilege of welcoming someone with deep experience in working towards a more just world. The Reverend Dr. Theoharis is co-chair of the Poor People's Campaign, a national call for moral revival with the Reverend Dr. William Barber. She is the director of the Kairos Center for Religions, Rights, and Social Justice at Union Theological Seminary. She is an ordained minister in the Presbyterian Church of the USA and teaches at Union Theological Seminary in New York City. Reverend Dr. Theoharis is the editor of We Cry Justice, Reading the Bible with the Poor People's Campaign. She is the author of Always With Us, What Jesus Really Said About the Poor, and co-author of Revive Us Again, Vision and Action in Moral Organizing. She has been published extensively in the New York Times, Washington Post, Time Magazine, The Hill, Guardian, and elsewhere. She has a range of awards where she has been recognized for her work, and I have long admired her writing and speaking. It's really a great privilege to host Reverend Dr. Theoharis. Dr. Theoharis, welcome.
Thank you so much. It's really an honor to be here. I am a huge admirer of the work you do, and am really excited to be in the conversation today on this challenge that I think we all must put to our public health systems.
Welcome. Well, I'm going to now turn it over to you to make your opening comments, and then we'll talk a little bit about those. Over to you.
Perfect. So pre-existing conditions served as fissures that the COVID-19 pandemic just deepened and spread. Those pre-existing conditions were, of course, health disparities, but they were also systemic racism and poverty, the lack of housing and clean water and healthcare. They were low-wage jobs and the lack of paid family and medical leave. And then connected to these pandemics of poverty and racism that preceded the COVID-19 pandemic, our nation, our society was not able to recognize that anyone that didn't have healthcare, that anyone who was working jobs at a low wage and didn't have any savings, anyone without paid sick leave or housing could impact everybody in our society, including those who had all of those things. We've yet to see the kind of interconnection and mutuality that as a society as a whole, where we actually come to see this idea that injustice anywhere is a threat to justice everywhere. And in the COVID-19 pandemic, that lack of view to see that when we had folks that didn't have a place to shelter when they were told to shelter in place, or when we heard about folks, having to quarantine or not work, but who couldn't really do that because of the economic conditions, the family conditions they were living in, that really only made the pandemic worse. Rather, in our society, we've gotten used to unnecessary death before COVID even hit. And for really years in the United States of America, there have been about 250,000 people who die a year from poverty and inequality. That's almost 700 people dying a day. And this is in a country that throws away more food than it takes to feed everybody. In a country that in cities across this country where there's 5 abandoned housing units for every unhoused person. And yet we've just gotten used to death and despair and exclusion. I think it's really important for us to take into account that despite experiencing the worst public health crisis in over a century, We have not seen a major expansion of healthcare. We haven't seen a raising of living wages. We haven't seen, paid family and medical leave. And this has been across multiple years of the pandemic. And then when we look at the kinds of pandemic emergency programs that were instituted, programs that were wildly successful, really helping to ease the burdens that many folks, millions of folks were experiencing, whether that was the kind of stimulus checks, or whether that was some of the tax relief through the child tax credit, whether that was moratoriums on eviction and utility shutoffs. Almost all of those emergency programs that came in under the COVID-19 pandemic, they were limited when they started, and they have now timed off. If we take something like the child tax credit alone, tens of millions of people were impacted, and more than 10 million people were lifted above the poverty line with just this one program, right? So how can we not do anything but question a political decision on the part of any of our elected officials, let alone the majority of them, who chose to not expand and not make permanent the child tax credit, let it expire, and with that decision, throwing 4 million kids with the stroke of a pen back under the poverty line. So it seems that we learned no lessons from the years of suffering when we see that programs of social uplift, when paired with other public health responses, are simply kind of thrown away, and folks are set back to kind of fend for ourselves. And I think this connects with another failure of the general public health response to the COVID-19 pandemic, and that's that we didn't really have a collective public health response. Much of the response was left to individuals. But what we know from history and what we know from this pandemic itself is that social problems need social solutions, not just individual ones. So you can't just rely on the goodwill, a sense of collective responsibility of individuals, especially when a society doesn't make it easy for folks to do the things that are necessary to not just help ourselves, but help our community leaders. Not be able to quarantine, not be able to afford to take time off from work, not receive the healthcare that people need. So because of these individualized responses to this public social pandemic, we've seen so much unnecessary death, many cases of long COVID that are going to have and are having already a lasting impact on people's lives and on our economy, and a government response that really turned towards neoliberalism and extremism in its nature. We saw things like the CDC making public health recommendations based more on what corporations needed. Lessening quarantine times, sending families, back either to school or into other situations before actually was healthy for folks, because people needed the workers. We saw lobbying on the part of the largest kind of multinational corporations, many of them fast food and other kind of corporations that employ lots of low-wage workers, leaving 85% of businesses exempt from paying any kind of paid sick and family leave. And this happens despite what's actually best for the health of everyone. And what we also saw, especially early on in the pandemic, was that as elected officials realized that the impact of COVID was impacting poor people and people of color the most, many of the larger governmental public health responses were lessened. And so policy choices really then mirrored this. This in and of itself is a crisis. It sends a message, a message that is sent far too often, that poor people, that Black people, that Native and Indigenous people, that Latino people, that older people are not important, and somehow people's lives are less sacred. And and to me, it feels deeply significant and deeply problematic that the CDC and our public health institutions haven't been collecting data on poverty, on income, on occupation, when collecting data about those that are getting sick and dying from COVID. I think we must question how are public health institutions supposed to be able to suggest interventions around public health when they're purposely not even gathering information about who is impacted and what communities are being impacted the most. This all brings me to like a favorite quote of mine from Reverend Dr. Martin Luther King, who says that an accurate prescription rests on an accurate diagnosis of the disease. So when it comes to public health, and when it comes to the related issues of systemic racism and poverty, ecological devastation, the denial of healthcare, we have to diagnose the larger social ills if we're serious about a healthy society. I would say it means that in order to heal individual patients, we must heal a society that's making us sick. I think then connected to this, it's important to point out that also a vaccination kind of only approach ignores both the history and culture of how unequal our healthcare system is and why there would be and are continuing to be communities who don't trust public health officials, that don't trust healthcare interventions and vaccines, and a system that doesn't and hasn't taken into account many of the special health needs and disabilities of so many people. And so, like so many of the public health responses to this pandemic have been really to the exclusion of differently abled people. And so all of this is to say that COVID in its early days was often described as a great equalizer. But I would like to suggest that rather than being a great equalizer where we're all in this together, it became very quickly a poor people's pandemic. And I want to share a little bit of a study that the Poor People's Campaign, along with the Social Sustainable Development Solutions Network, as well as the Kairos Center on Repairs of the Breach, put together about the health impacts and death, especially caused by COVID, but also kind of poor and low incomes. And so I'm going to share a couple slides with everybody right now, and then so the report that we published, and it's still available on our website and other places. It's a Poor People's Pandemic Report. It's mapping the intersections of poverty, race, and COVID-19. And I think there's a couple of things that are really important in findings that I want to show. So first off, between 2 and 5 times the deaths of poor and low income people to wealthier people. So you can see after that first wave. So in this chart, you can see that the blue is higher incomes, the red is medium incomes, and the yellow is low income people. And after that first wave, where so much of who is where there were so many people getting COVID, especially folks that were moving around and traveling in some of our bigger cities, that every other subsequent wave of COVID, and this is just data through February and March of 2022, showed that again, between 2 and 5 times the number of poor people were dying rather than richer, wealthier people. And if you look a little bit more closely, this shows the kind of death rates at the different waves by income. And I think one of the things that I really want to point out here is that even not very significant changes in income, you still see how the richer people get, the fewer deaths from COVID. And when you see a correlation like that, when you see that basically that your chances of dying from COVID rise greatly if you're poor and low income. This is in itself a public health crisis. So I want to say a couple of the key findings of this report, because I think it really relates to these kind of challenges that we're talking about here. So again, just to restate that during the pandemic, people living in poor counties died at nearly 2 times the rate of people who lived in wealthier counties. And in the deadliest phases of the pandemic, as much as 5 times. So when we look at 300 of the counties with the highest death rates, the poverty rate in those counties is 45%, and that's the official poverty line. If we were to actually take into account those that can't afford a couple $100 emergency, it gets even more stark. And that is a rate of 1.5 times higher than in counties with lower death rates, right? The median income in the counties with the highest death rates have on average $23,000 less dollars than the counties with the lower death rates. Again, we're just talking that more or less the poorer people are, the more likely people were to die from COVID. And then it's always important for us to kind of disaggregate the racial demographics and all demographics of who's being impacted. And so, the population across these 300 plus poorest counties with the highest death rates were 56% white, 21% Hispanic, 16% Black, 4% Indigenous, and 1% Asian. So the next piece is that vaccination status alone can't explain all the variations in death rates. And so I think there's 2 things that are really important here. That in the counties with the highest median income, right, in the kind of richest counties, folks have more insurance, right? I mean, this on some level, I think is making a point that we probably all know, but that it's really important for us to show that in so many of these communities, in so many of these counties where people were dying, folks just did not have healthcare insurance. And then it also is important for us to point out that actually the majority of people living in those poorest counties have received their full vaccination of COVID, and yet still the level of death is much higher than counties, including some counties that had the same vaccination status and rate, but who were much wealthier. So I just wanted to kind of make some of those points, and then kind of conclude at least this section by saying that it doesn't have to be this way, right? That all of these points that I'm raising are challenges, are fissures, are inequalities that we have seen and are very real in our life and in our society. But it doesn't have to be this way. It's if we expanded healthcare, if we enacted a universal single-payer healthcare system, everyone could get the kind of healthcare they need. If we raised wages, we could, if we passed paid sick leave, if we ensured that everyone had adequate housing and utilities and water and things to thrive, if we valued people for themselves and not how much profit they make for corporations, we wouldn't have to risk the lives of the sick and vulnerable just so folks can kind of go back to normal. And if rather than going back to a normal that didn't work for the majority of people, we work to address kind of underlying injustices and inequalities, we could organize our society in a way that if another pandemic hits, we don't have the same kind of outcomes. As a theologian, as a biblical scholar myself, I think about sacred scripture. And what the Hebrew scriptures remind us is that we have to kind of raise the foundations of injustice and start building from the bottom up and centering the poor and marginalized if we want justice in our society. And so what that says is that in our policies, in our economics, in our public health response, when we lift from the bottom, everybody rises. And so that's the message that I bring. That's the work that we at the Kairos Center and the Poor People's Campaign, a national call for moral revival, are trying to do. We need to kind of point out what's wrong and how it's disproportionately impacting poor and low-income people, and then we have to shine a light on what's right and what's possible, and then kind of build the compelling power to have a public health response and a larger political and social economic response that values the lives of everybody and actually puts people and people's lives and livelihoods first. So thanks so much.
Well, thank you, Reverend Theoharis. That was terrific. Let me, I want to take a step back, and then I'm going to come back to the content of what you said. But maybe you can start us off a little bit by telling us a bit about yourself, about your background. Can you just trace, how did you come to do the work you're doing now?
Great. Yeah. So I have been doing this work for a very long time. I was raised in a family that was very dedicated to doing the work of social justice. And when I went to college, I connected up with some very grassroots anti-poverty organizers and have been kind of looking at what it looks like to build a social movement from below for about 30 years of my life. I was raised in the church and at some point realized that my kind of call to work and organize amongst poor and low-income people was a religious one. And so I am ordained in the Presbyterian Church, and I did a PhD in biblical studies, especially looking at what our sacred texts have to say about poverty and justice. For, again, about 30 years, I've been doing very grassroots anti-poverty organizing amongst, who I would call some of the heroes and heroines of our society, folks that are kind of left out and locked up and pushed away, but who make up some of the 140 million people who are poor and low income in this, the richest nation in the world, who are saying it doesn't have to be this way, and we can indeed address racism and poverty and ecological devastation, the denial of healthcare, and this kind of false narrative of religious nationalism, and we can make society into what it needs to be for everybody. And so I come to this work both from a faith perspective and also as someone who myself personally have faced some of these economic challenges before, and out of that have been lucky enough to connect up with grassroots leaders and scholars and people from all walks of life who are trying to make life better for everybody.
Can you tell us, talk to us a little bit about the intersection of religion, faith, and activism, and how do the three play out together for you?
Yeah, so I mean, I fall back on a bunch of biblical texts, but one is what my mom's favorite one was, which was Micah 6:8. What does the Lord require of you but to do justice and to love kindness and to walk humbly with your God? And I think that passage itself basically speaks to the intersection of faith and justice and activism. So again, we live in a nation and in a world that has the wherewithal to be able to address injustice. And I follow a religious tradition that like most religious traditions from across the world, prioritizes and centers itself around justice and the poor. The inaugural message of Jesus when he goes to his hometown and starts his ministry is that the Spirit of the Lord is upon me. I have been anointed to preach good news, not the bad news of eviction and the lack of health care and sickness, but good news to the poor, those who have been made, poor by systemic injustice. And so for me, if I'm gonna be true to the religious texts and teachings of my tradition, as well if I'm going to pay attention to what's really going on in our society around us. It compels me, and I think many people, to be involved in the work of doing justice, and says that it's our obligation to actually both point out what isn't going right, talk about the real moral issues of our day, the lack of healthcare, the lack of living wages, the lack of social programs of uplift, and then to kind of come together, band together, unite together with people from all walks of life to put forward solutions and build a kind of compelling power to enact that agenda and those solutions to have it so that everybody can thrive and not kind of just barely survive in this world.
May I say how much I like the term social programs of uplift? That's really terrific. Thank you. So let me now pivot to content now, some of the work that the work you've been doing and we've been talking about. So let's start with poverty. So addressing poverty is obviously central to your work, and it's also core to the work of public health. Can you, from your perspectives, did public health do enough to support those affected by poverty who were dealing with the intersection of poverty and COVID-19? And assuming that we can always do better, how do we do better? How can we do better?
Yeah, I mean, so I think one of the places, and this relates to public health and it relates to other kind of other societal institutions, is that we have to start with actually truly measuring who is poor and truly understanding why people are in poverty. I think we have gotten used to in our society, including in our public health spheres, of kind of misdiagnosing who is poor, the depth and extent of poverty. And so again, it's been very important for us as we kind of organize this Poor People's Campaign to go and look at the data and look at the kind of poverty measure, including the inadequacy of the current measures of poverty in this society and actually in other societies as well. And so I think for one, if we don't have a sense of who is actually struggling. So for instance, I think an example in the pandemic is that that first set of stimulus checks, the first set of pandemic unemployment that was more like $600 of payments, that would have been at a rate of a $15 an hour wage, right? And so that was starting off in what would have been a better place, right? But the next time around in our policies, we get it down to $300 payments. It's because our politicians are trying to kind of sync it with the actual federal minimum wage, which is $7.25 and hasn't moved in 13 years, right? So again, you see that not having an adequate poverty measure then impacts whether it's economic policies or social policies or public health policies, because if you're not measuring who's actually being impacted, if you're having it a smaller group of people, if you're kind of isolating folks and not seeing the connections between folks that are under the federal poverty line and folks that are just above it, but who are going through many of the same struggles, I think we don't have the kind of quite right approach. And so I think we have to start with, and I think public health could help us to adjust the poverty measure that exists in our society and say that, something that was developed back in the 1960s that was just about 3 times a food budget, because that's how our poverty measure in this country, the federal poverty line, is measured, actually isn't going to speak to whether folks have healthcare, whether folks have transportation, whether folks are living in adequate housing, whether families can afford to buy multiple pairs of shoes if one gets wet so that the others are dry. These are actually health concerns. These are standard of living concerns. And so I think one place that we were failed across the board was we didn't see how many people were in poverty or close to poverty. And by, as I said in my opening, by not actually having our public health institutions measure and track who's getting sick and who's dying, so that it took a long time, and it took outside researchers to show that actually poor and low income people were dying at much higher and faster rates. And so I think so one is this question of measuring. Then connected to that, I think so often, even in public health, we look too narrowly at what people need for good health, and that we don't necessarily see the connections, or even when we do see them, we have to be pulling these out for the rest of society to see that systemic racism and poverty and environmental injustice and the kind of militarization of our communities all actually have a public health impact, that then, when combined with a pandemic like COVID, really only hurts poor and low income people first and worst, and only kind of deepens and spreads that. And so again, there have been some amazing public health officials and leaders that are very committed to justice, who throughout the pandemic have been raising these same issues. But we need more of it, right? We need to hear that racism is a public health, crisis. We need to hear that anything, that not having clean water means that we have to figure out how are we going to clean up the water in thousands of communities and in millions of homes and workplaces across this country, if we're serious about public health. And then I think when it comes to this question of what we can do better, I mean, again, I think when we more fully define what poverty is and what some of these public health crises that connect and intersect with a pandemic or with a public health crisis, and disease and virus, then I think what we have to be out there saying is that we need programs that actually, again, impact people's lives as their whole lives. So when, for instance, that child tax credit wasn't expanded, to have public health officials and public health researchers and others out there saying this is gonna hurt the lives and livelihoods of millions of people, and this is a public health crisis, right? Cutting people off of the kind of care and help that people need is a crisis, and we need to do something about it. And so to me, there's both the kind of response that has been kind of inadequate, but then also in the places where we saw real solutions coming forward, to have public health folk be able to kind of join in a choir of voices saying, this, don't do this, or do this, or invest in living wage jobs, invest in paid sick leave, expand healthcare, do all of these kinds of things, because it'll both have an immediate health response, but it'll also, improve some of those fissures that existed that the pandemic was just able to spread and deepen around.
Thank you. For the audience, I'm going to get to audience questions in a second. I just want to ask a couple of more questions of Dr. Theoharis from my own questions, and I'll come to audience questions. So let me ask you slightly different questions, if I may. In your book, is Always With Us, your book, which I recommend strongly to everybody, you critique the idea of charity, and you argue that in some sense it's a distraction or an evasion of the work of creating systemic change necessary to end poverty itself. And you argue that this perspective both is reflected in the Gospels, and also you use the Martin Luther King quote, which I've also used in some of my writing, which is, "True compassion is more than flinging a coin to a beggar. It comes to see that an edifice which produces beggars needs restructuring." Now, I think this aligns with public health's approach to poverty, and which is actually why I've used it in my writing, and with poor health in general. Can you just talk a little bit about charity from your perspective? Can you talk a little bit about why charity is necessary but not sufficient, and why, perhaps even more strongly, it may be a distraction or an evasion? Which I'm paraphrasing you, but I think that's what you were getting at in your book.
No, that's right. And I really appreciate this because I think, so much in our society, we're told that kind of the only way for us to address, inequality and issues of economic disparity is kind of to fling a coin at a beggar, right? Is to, donate some money or start a mutual aid kind of, food program, or to, open up free clinics, which of course we need, of course we need. But so many of these kind of charitable acts and activities then often, for one, do distract from the kind of the greater social injustice and economic injustice that exists in our society. And it's almost like putting a Band-Aid on a gaping wound, right? Like it's not going to actually solve the problem. It's just going to kind of cover it up so that the rest of society doesn't really have to see it. And so, I think when it comes to the work of justice and the work of public health, having a justice approach, or starting with maybe these acts of mutual aid or charity, meeting people's immediate needs. I mean, of course we have to do that, especially when people are just hurting so much right now. But it can't be, it has to be an initial act. It has to be a first step. It can't be an end. It has to be a means to then getting involved in advocacy work and organizing work and protest work and policy work. And that advocacy and policy work, has to be about, putting forward solutions that are more universal and that actually reach so many people. And I think, one of the things that we've gotten very comfortable with in our society is putting on Band-Aids, and it has, the kind of corporate giveaways and people patting themselves on the back and saying, look at how great of a job I did. But again, when you look at the breadth and depth of injustice in the society, it's going to take some real social transformation, political transformation from the bottom up to actually, get at the kind of roots of injustice. Whether that's in health inequities or whether that's in disparities around health or education or so many of the different issues that are impacting just millions upon millions of people. And so indeed, we have to meet people, and we have to meet people where they're at with their immediate needs. But then that has to be, just the first step, as we then kind of join with folks in building, strong social responses and an actual movement that can change the priorities of the society at large, and put forward the kind of compelling power to get the demands that people have.
Thank you. So let me ask a question. I had this as a question, but one of our attendees has also asked this an anonymous question. But broadly, I'm going to ask in between the two. Public health's relationship with religion has, I think, at times been ambivalent, and in particular about the role that many religions play in promoting attitudes that are antithetical to social conditions that support health, for example, anti-LGBTQ attitudes. So at the same time, of course, religious traditions contain, and in some cases introduced, much that's fundamental about our understanding of human rights and the need to pursue a more just world. Can you sort of help us work through that? How can public health strengthen its engagement with the best of religious traditions? And conversely, how can we make sure that we elevate and surface the best of what religion has to offer to the end of generating the health of populations?
Yeah, I think it's really important. I mean, right now, we're living in a moment when we have real religious extremists that more or less are the main religious voices in our public world today, and those dominant hegemonic extremist voices are really counter to the principles of public health and the principles of justice, and so I think, for one, being able to kind of point out that not only are those kind of scientifically wrong, but those are morally wrong positions, including from different faith traditions. Being able to talk about, that an injury to one is an injury to all. That when we center our responses around those that have been marginalized and bring the margins to the center, these are actually, I think, both principles in public health, but then also principles in our religious traditions. And I think we can't, as speaking as a person of faith and as someone who's organizing other religious leaders, we can't concede some of those interpretations and theologies, to folks that really are not interested in the health of our larger society, but who instead are amassing great wealth and power at the expense of others. And so it is a difficult and of a dance, right? But I think to for one, to recognize that many people in society, follow religious traditions that actually proclaim that, like, healing and abundance is what our society should be organized around. And then I think to be able to partner with leaders of faith communities who are sometimes a place where people are coming with health and other crises, and to be able to then put out and show that again, that there is a different vision out there, and that and so to speak morally, as you speak out as public health experts, not necessarily morally around a particular religious tradition, but that there's right and there's wrong, and that actually what's healthy for society is also kind of the morally right thing to do. I think, but I think not shying away and it's not just public health that has this relationship with religion. I mean, it's we've seen a kind of battle of theology throughout all of our nation's history, with whether it's whatever issues of our day are playing themselves out. You have folks that are covering themselves with religious justification to just kind of exclude and demean people. But again, that's not what's at the heart and center of our faith traditions. And so we have to hear that as well.
I really appreciate it. Another expression you just used, which I really appreciate. We cannot concede those theologies. I really like that. Thank you. Let me, there's a question which I think is related to this, also from somebody anonymous in the audience, who said, how do you reason, and maybe I'll expand it to engage with people who are religious yet anti-social justice or perhaps even racist?
Yeah, I mean, I think, again, I think from a faith perspective, I think it's not just reasoning with people, right? But I think you can engage in, including, if we look at our sacred texts, and we take the words justice and poverty and healing out, the whole Bible falls apart. And so I think from there, you can engage with folks saying, like, well, what's at the heart and center of these texts, of these teachings, is contrary to racism. It's contrary to marginalization and oppression, and that anyone that is kind of using our texts and our traditions to kind of as a battering ram against people isn't holding up what really those texts and traditions say. Now, I also think sometimes it's important for us to not just try to disagree with some folks that hold their positions, but to pull more people in around the kind of principles of justice. Because what I have found is that there might be a core of people that have very extremist, very racist views and readings of our texts and traditions, but then there's even more people who, when you hear about the idea that we have to heal a society that's made us sick, or have follow someone like Jesus who travels around setting up free healthcare clinics, never charging a leper a copay, right? I mean, like, what people are very excited by that reality. And so sometimes it's about engaging the folks that disagree, but sometimes it's about pulling together that remnant of people that already are for justice, and being able to strengthen and grow and build a bigger tent from there.
Thank you. Let me ask you a question from Dr. Bahadur Basnat, who's a community physician in Nepal. When we're thinking about COVID and where it's been going, and looking at the history of other tropical diseases, is COVID running the risk of becoming a neglected tropical disease in the future, or disease affecting poor people mostly, both in the US as well as around the world?
I mean, I really fear a number of things with what our COVID response has been. I mean, one, the fact that we were willing to not vaccinate the whole world, is a huge moral, but also, material crisis. The fact that there are, thousands dying every day from COVID, and yet we have just kind of moved on. I do fear that that with the kind of our response, it's that we're allowing it to just become a disease that will mostly affect poor and low-income people in the US and across the world. And basically, because it's mostly disrupting those lives, the rest of society doesn't care. And so I think we would do well to still take very seriously what it's going to take to actually get rid of COVID, or at least come up with a public health infrastructure in the US and across the world that is serious about putting people's lives and healing first, and not again kind of being willing to in this country call workers essential but still treat them as expendable in our policies, in our COVID response. And so I appreciate the question, and I think both with COVID and with future diseases, I think we have a lot to learn with the inadequacy of the response to COVID so far. When you hear that there's in the United States hundreds of thousands of the folks that died, they were unnecessary deaths because of basically inequality existing. That if we had living wages, if we had a better healthcare system that actually healed people and didn't kind of just treat folks until they could kind of go back to work. It can be different. We can do it differently. We just have to do it.
So you, in this answer, you use the phrase, and I made a note, moral and material crisis, which I really like. And it links to a question which I had for you, which is, public health is in many ways based on scientific materialism, concerned with observable fact. And yet we're also concerned, and what we should be, I think, with what one might call, let's say, faith-inflected values of justice, compassion, and belief in right and wrong. How would you challenge public health to deepen its engagement with these values?
Yeah, I really, those are, both definitions are so helpful, because again, we if we're serious about trying to, help people's material well-being. It's a choice at this point, that, like, again, when we live in a society that has the capacity and has to be able to address people's needs, whether people's material needs, right? Whether it's uh, housing or healthcare or food or utilities, as well as, we just have, I think about, a city like New York City where I live, or Philadelphia where I lived before, where you have, unbelievable, scientific and medical, expertise and invention and innovation. And yet you have the kind of level of inequality and disparity that exists. There's something even more kind of approaching spiritual death and an immorality when you actually have the wherewithal and the means to address the material conditions that people are living in, and yet we don't, right? And so I think we are in the Poor People's Campaign calling for kind of a moral revolution of values and a revival of our deepest, constitutional and moral values, where and what are those? Those are about justice and equality and equity. And again, I think traveling around this country, which is what I do for most of my time, in engaging with people, many of folks who are the kind of most impacted by COVID, by the lack of healthcare, by low wages, by the lack of social programs. I hear over and over again that it doesn't have to be this way. That people are ready for kind of a moral revolution of values, and that it's really not, as we talk about in the Poor People's Campaign, about kind of left versus right. It's about right versus wrong, and I think that we can bring that into the kind of public health discussion, especially when it comes to these questions of values, and say, what is it that we have people, freezing to death right in front of public housing? What is it that we have, half of the kids in this country living in food insecure homes, when there's all of this food that's being wasted? That's a material problem, but it's also a moral problem. And there's a solution to it, which is to change the kind of moral consciousness and the political will to be able to actually, heal people's whole selves.
So the moral revolution of values to avoid spiritual death. I'm simply underlining some things that you're saying that I'm making notes for myself. Thank you. Let me ask a question modified from Alison Bowman, which is that poor and middle income people of all races have much more in common with one another than, say, the 1% highest income or highest wealth Americans. So one would think that there's plenty of common ground for solidarity around some of these values that you are suggesting. And I suppose, how can one think about catalyzing collective power to shift towards policies that help the majority of people, not just focusing in this country, although one can extend it to the world, away from policies that favor only a select few?
So I think what I see, again, across the country is people do see that we're in this together. And I think, when we kind of push our politicians to take up the kind of demands and priorities of even poor and low income people, what we see is that those are many of the kind of demands and priorities of close to all of the society. Again, maybe not that 1% of the 1%, but whether it's the kind of rights afforded to women and LGBTQ folks, whether it's a decent living and the kind of freedom to live and love, whether it's about education to the fullest extent of our human rights and dignity. these are issues and these are concerns that again are coming out of poor and low income people's lives and their demands that folks have to have because they're compelled to have them, but they're concerns and their values that reach a lot of people, really the vast majority of people. And so to me, one of the roles, especially of social movements like I'm involved in, is kind of making those connections and uniting and organizing people, across these lines that have historically divided us, race, geography, religion, but also income and partisan politics and all of these different ideas. Because again, when it comes right down to it, there's so many, the vast majority of people in this country, want a strong democracy, want programs of social uplift, want, to kind of lift from the bottom so that everybody can rise. And so the kind of challenge to us then is pulling those people together. And I think one of what things that we're seeing is working is reaching out and building, kind of permanently organized communities of folks that are impacted by all of these different issues, but coming across income, across all walks of life, into like kind of a powerful, what we call a fusion movement from below.
Thank you. I now have 20 more questions or points of conversation, but I'm aware of the time. So I'm just going to ask you one last question, if I may. We're in a moment where for many it's hard to be hopeful. And may I ask you, what does hope mean to you, and how do you find hope amidst setbacks and struggle?
So as a theologian and as a pastor, I think about hope and faith as like very connected. And I actually had just entered seminary when September 11th happened. And many of my classmates at that point were kind of saying that they had kind of lost all faith because something bad had happened of what happened on September 11th. And I realized that having organized and lived amongst many different poor and impacted people across the country and world, that hope and faith meant something different. It was that even though only bad things have happened, even though people are constantly under assault and having to bury family members, that people still believe that something different is possible and it doesn't have to be this way. And so I think that that's the kind of hope I hold on to. It's like a hope in hard times, right? It's not an idealism. It's not like, oh, look how rosy everything is. But it's like facing into kind of the deep chasms that exist in our society and saying, okay, people have been through this and worse. And if folks who are currently unhoused and without adequate health care, having to bury their kids for the lack of health care, are able to see that we can change all of this, then who am I not to join in on that fight? And so I get amazing hope from organizing and uniting with some of the poorest people in this country, who are saying everybody's got a right to live, and we're not going to be silent anymore. And we're going to be this new and unsettling force for change in our society. And we're going to lift from the bottom so that everybody can rise.
Reverend Dr. Theoharis, it's so wonderful talking to you. I very much admire the work that you do, and it's a real privilege to be having this conversation. Thank you. Thank you for the work you do. Thank you for joining us in this conversation. And thank you to the audience for really excellent questions. There have been a number of things in the chat that reference Reverend Theoharis' books. Thank you, everybody. Have a good afternoon. Have a good evening. Take good care.